Hey guys, welcome back to Radiology Lens. In today's video, I will be discussing the definitive and diagnostic features of failed pregnancy on ultrasound. There are 4 features that are definitive in diagnosing a failed pregnancy. These are: number 1, crown rump length or CRL of greater than or equal to 7 millimeters with no cardiac activity. Number 2, mean sac diameter or MSD of greater than or equal to 25 millimeters with no embryo. Number 3, absence of embryo with cardiac activity 2 weeks or more after a scan that showed a gestational sac without a yolk sac. Number 4, absence of embryo with cardiac activity 11 days or more after a scan that showed a gestational sac with the yolk sac. Let's see a few images of failed pregnancy. In this image, you can see an embryo with CRL measuring 7.2 millimeters. When M mode was applied to the same embryo to check for a heartbeat, there was no cardiac activity seen. So this is a definitive failed pregnancy. In this image, you can see a gestational sac of greater than 25 millimeters with no embryo. This is also called a blighted ovum or an anembryonic pregnancy. This is another image of a gestational sac of greater than 25 millimeters with no embryo. Also note a small hematoma near the gestational sac. This is also a blighted ovum or an anembryonic pregnancy. This image shows a gestational sac with a yolk sac indicated by the arrow. On follow-up scan after 12 days, you can see an embryo has still not developed and only a yolk sac is present. So this is also termed as a failed pregnancy. This brings me to the end of the video. If you enjoyed watching this video and found it informative, please give it a thumbs up and subscribe to my channel, and inshallah I'll come up with more such content. Thank you.